A survey conducted by the Human Sciences Research Council has revealed that at least 26% of South Africans have no money for food. This is while up to 25% of people in rural areas indicated that chronic medication is not easily accessible due to the COVID-19 restrictions. These statistics also come as the world debates the relaxation of restrictions to allow for the resumption of economic activity while still trying to curb the spread of the virus. For more on this, I'm now joined by Democracy and Governance Program Leader at Oxfam South Africa, Mthandazo Hlahla, who joins us on the line. Good evening and welcome to The Full View. Starting off here, what exactly is it that we should be reading into these stats about the state of the poor?
Good evening, Aldrin. Well, it's quite severe and dire. I mean, it's not surprising to a great extent because we've always known that 10% of South Africans earn up to 65% of all the income, and in numbers, it simply means 3,500 people. That is 0.01 of the adult population control all the wealth of the nation. But of course, we are in a state of disaster. As you say, 66% of the people in the informal segment are on the verge of going hungry or unable to buy food. And that's quite even severe in rural areas where 1 in every 2 persons in the Eastern Cape and 1 in 3 persons in KwaZulu-Natal continue to face hunger, and the figure continues to rise. And this was as in 2017. Now that everyone is at home, people are not able to access their jobs and a livelihood, the circumstances will be even more severe, and people's dignity have been severely impaired.
We also heard from the World Food Programme Director, who was addressing the Security Council of the United Nations last week, indicating that they fear that the number of people who are going hungry will increase during this period. And the question then is that how then do the different states respond to this? I know that here in South Africa, for instance, we've seen that the President has made an announcement around relief efforts to help the poor.
Whilst we welcome the COVID-19 social grant, I think there is room for review and improvement of that figure, maybe to close to 561 or so, that being the lower band poverty line, and perhaps the best would have been 810 per month. That at least would cushion our people from falling into more distress and destitution. But I think significantly to highlight is that, as you say, globally in the Western Sub-Saharan Africa, as the governments consider relaxation of economic activities, I think there is other sectors that are excluded, the informal sectors, the cross-border informal sectors, who have been in most cases the one moving food items within the regional context of Southern Africa, whether to Lesotho, to Zimbabwe, to Mozambique, and they remain under lockdown. And that's going to be catastrophic if there is no deliberate intervention to lift the ban or have some interventions that support their gradual reintegration into the main extreme economy.
We just played a clip earlier on from the leader of the Economic Freedom Fighters saying that the government should be assisting foreign nationals who are in the country also affected by this lockdown. Do you think it is the duty of the state to also assist those who are in the country, whether legally or not, during this time?
Well, hunger has no jurisdiction. Section 27 of our Constitution guarantees everyone a right to sufficient food. And then that becomes an imperative for the state to provide food to all those that live in it. They, of course, we can look at what are the logistical requirements to be able to do so that we're able to reach out to millions of people, most of them who are in the informal segments. And then, of course, we have part of the contribution to food insecurity is the concentration of food value chains in the domineering supermarkets. I think there are other role players in the value chain, such as the spaza shops. They should be given an opportunity to contribute towards the distribution of food parcels. Now the government is talking of food vouchers. There could be a stronger mechanism that brings civil society, private sector, and government partnerships for the government to be able to distribute. For instance, if universities are able to deliver books to learners, why not explore the same mechanisms, even, for instance, the aged members of our society who go to hospitals to access their medication every month? Why not deliver on a day-to-day basis? Those are mechanisms that the government should be able to explore.
Mm-hmm. Just the final one is, you spoke earlier on about at least 561 rand that you would have expected government to announce in terms of relief efforts, and also looking at the impact of COVID-19 will have even beyond when we say that we are now lifting the restrictions of COVID-19. Is there any other mechanism that could be used to help cushion the blow on the poor, taking into consideration that you also have food companies or retailers that have increased prices?
Well, I think massive investments should go as well to small-scale farmers beyond the current crisis, looking at the post-corona, looking at the recovery phases, and supporting informal traders, just like the government is providing bailouts to big and well-established companies. I think there should be clear targeted interventions that support small to medium enterprises, informal traders, cross-border traders, and because these are the people who are closer to the reality in most cases, and of course investments that would recapitalize subsistence farming in the rural areas, and of course prioritizing women in the value chain of food production.
Well, thank you so much for that, Mthandazo Hlahla, who is the Democracy and Governance Programs Lead at Oxfam South Africa.